wherever you are. We're recording in progress. You're all very welcome. My name is James Casey, and I work for CBM Ireland on a disability and gender inclusive climate project called Funding Fairer Futures with our partners across the world. We're a very exciting webinar today, and we're very delighted to be part of this webinar entitled Climate Justice for Disabled People, People with Disabilities, a case study in people with albinism. And we're wonderful to work with the absolute wonderful people in the African Albinism Network and others across the spectrum. So this is a very exciting thing. This is a really crucial issue. Climate change is not going away. It's going to be part of our lives. And disabled people and people with albinism and other groups are part of this discourse and this dialogue. So we have a wonderful selection of speakers today. We have IK Iro, who is the Executive Director of African Albinism Network. We have Mr. Mohammed Sadiq Khan, who is representing Climate Justice International, Climate Action Network International. We have Mayar Molman from the Global Fund for Disability Rights, the Global Fund for Human Rights. I apologize because I'm still on the human rights or the disability rights style. We have Jaime, who is the policy officer with African Albinism Network. We have Ms. Ivy Kilhara, who is a CBM Global board member. We have Mr. Boniface Massa, who is the executive director of Standing Voice Malawi, and a friend of mine. So thank you so much, and we'll go through this today. So first of all, I would like to introduce IK Iro, who will kick off today's meeting and today's webinar, and we're going to work through today. So thank you so much. IK?
Thank you, James, and welcome to everybody. Thank you for taking your time, giving us time out of your very busy schedules. It has been said, my name is Ikwamosa, but everyone calls me IK as my nickname. Don't feel bad to use that. I am a person with albinism from Nigeria, although I'm currently sitting in Vancouver, Canada for this webinar. First, I would like to thank CBM Global for their generosity in supporting this webinar, the Fund for Global Human Rights, Climate Action Network. I would also like to thank all the speakers who are agreeing to be with us here today. Very briefly about the Africa Albinism Network, since it's probably the least known among the co-hosts of this webinar. It is a relatively new, small NGO, and one of its main tasks was to respond and is to respond to the protection of people with albinism. As many of you already know, that they have been facing physical attacks in the last nearly 2 decades, with hundreds of cases of death and mutilation recorded. One of the issues that had fallen by the wayside in the zeal for us to respond to the attacks is the issue of climate change related deaths of people with albinism. The increasing UV rays caused by climate change is the #1 killer of people with albinism, since the data that we often see shows that it kills most people with albinism, many people with albinism before the age of 40 or 30, according to the source. We hope in this webinar that we will be able to share with you very quickly some of the pertinent details about the situation, how you can take action, including how you might be able to support some of the work we're doing to promote the inclusion of people with disabilities through the particular case of people with albinism in climate justice spaces. And I thank you very much and look forward to engaging with you. Over to you, James.
Thank you so much, IK. Really appreciate that. Folks, I forgot to mention at the beginning, because it's a day that I haven't had enough caffeine. We're going to have a couple of videos in here today to show. We have a wonderful video, hopefully, if it works, because technology is like that. Technology is just sometimes a little bit iffy. We have a wonderful video from a young woman called Leila, and then we have a fantastic message, thankfully, from Maluka Drummond, who is the UN independent expert on albinism. And we're very grateful to have that. So Debbie, will we try and see if we can share the video first from Leila?
Sure.
My name is Leila. For me and for many people with albinism across Africa, our right to education is a matter of life and death. Because albinism often causes vision impairment, we need reasonable accommodation and support to access education. Without education, people with albinism end up working outdoors, where the harmful rays of the sun cause skin cancer. Low education rates and climate change are some of the reasons why skin cancer is the #1 killer of people with albinism. As climate change worsens and harmful UV rays increase across Africa, we ask for support from our government to ensure reasonable accommodation in schools. As for you watching me now, you can also do something. Help save people with albinism from dying from skin cancer. You can do so by signing the petition in the description to ask the World Health Organization to include sun blockers on their list of essential medicines.
Thank you, Debbie. So everybody, that was a bit of a teaser. We don't want to say too much about the petition that Leila mentioned there. That's coming. We've got something very big surprise, and it's wonderful. That was a great, and we will share that video of Leila afterwards in an email to you guys. So everyone will have this information that you can pass on to your networks and your colleagues and your friends and your family, hopefully. Could we show the message from the UN expert, please, Debbie?
Good morning, good afternoon, good evening, depending on where you are. I hope all of you are well today. I'd like to start by thanking CBM, AAN, and CAN for inviting me to this very important webinar on climate justice and persons with disability, with a focus on persons with albinism. Interaction between climate change and persons with albinism is one that is very important for my mandate. In fact, I started my mandate in July 2021 with a vision of, among other things, including persons with albinism in areas of human rights where they have so far remained invisible. Climate change is one of these areas. Due to the correlation between increased climate change, UV rays, and skin cancer, to which persons with albinism are highly vulnerable, persons with albinism are disproportionately negatively impacted by climate change. Yet they have not been included in discussions on climate change mitigation, adaptation, or climate justice, including discussions around the Loss and Damage Fund. To date, there has been little mention of persons with disabilities in general, let alone persons with albinism, in relation to climate justice policies at the national and global level. However, available research shows that persons with disability, including persons with albinism, are among the most vulnerable before, during, and after climate change-related natural disasters. They're less likely to have warning signs in accessible formats prior to the natural disasters, more vulnerable to injuries and loss, including loss of livelihoods and lives during the disasters due to visual impairments or other impairments. And they may sometimes even be scapegoated for the disasters. In the case of persons with albinism, such disasters may increase the likelihood of attacks against them by those who wrongly believe that their body parts can provide some form of wealth or fortune. Furthermore, there tends to be a correlation between the vulnerability of a country or region to climate change and the prevalence of albinism. For example, in 2023, there were 7 African countries on the list of top 10 countries at risk of climate disasters, and Africa has the overall highest continental prevalence of albinism. In addition, small island developing states are generally considered highly vulnerable to climate change due to rising sea levels caused by it. At the same time, they are among those countries that have the highest national prevalence rates of albinism. Given all this, it is quite surprising that persons with albinism and those with other disabilities have not been given more of a voice in climate justice discussions and programs. Failure to ensure their active participation in such discussion can lead to serious human rights violations. For example, sunscreen is an essential drug for persons with albinism, which is becoming even more essential with the impact of climate change. Yet it is financially out of the reach of most people with albinism, particularly in regions with the highest UV index. Additionally, with the increasing UV index worldwide, we are all at risk of skin cancer. Ensuring that sunscreen is on the national and international essential medicines list and accessible is literally a matter of life and death, and a move that can eventually benefit everyone. Failure to do this not only violates the right to health, but may also constitute a violation of the right to life and other rights. at this point in the ongoing climate change discussion, it should be obvious to all concerned that there can be no real climate justice without the inclusion of persons with albinism and other disabilities in these discussions. Once again, I welcome this webinar and the very important topic it addresses. I wish you all a fruitful discussion and thank you for taking the time to listen. Have a good day.
Thank you, super, and thank you very much to Maluka and Drummond for sending on that message of support. We really are grateful, and it shows that the forces of power and collective spirit that's behind this. Now, moving swiftly and seamlessly on to our next speaker, I'd like to introduce Mr. Bonfed Massa, who is the Executive Director of Standing Voice Malawi. Bon?
Thank you, James, and thank you everyone for joining. It's great, I think, for us to also share our experience. So I work with Standing Voice. It's an international organization with a specific focus on promoting the rights of persons with albinism. And we have a holistic approach to our work, where we work specifically in issues of access to health care, preventing skin cancer, but also building capacity of health workers. We have also a psychosocial support program, working with victims of torture and survivors of the attack, and we do a lot of advocacy work at national level and international level in several African countries. It's an honor to join the discussion today around climate change, because there is a direct relationship, as Maluka said, around us as persons with albinism and the effect of climate change. In particular, I would want to share our experience here in Malawi, the work that we have been doing as Standing Voice through the grant that we received from the Green Grants Foundation, where we trying to understand the effect of climate change and persons with albinism. In particular, our focus is for the last 4 and 3 years in Malawi, you have seen increased cases of droughts. We were hit by the cyclone threat and the natural disasters. And during our work using the skin cancer prevention program, which is now covering over 20 districts across Malawi, these are like both rural sector and urban sectors across Malawi. We have been now trying also to see what has been the challenges of people with albinism and the effect of climate change. So apart from this, the issues of health in terms of sun damage that has been also talked about by Maluka, interestingly was how climate change issues of disasters have affected increased threats to lives of people with albinism. So we registered cases of people with albinism being attacked when they were in this evacuation camps during disasters. We registered a lot of people with albinism lost their sunscreen, their hats, which are the basic required needs to protect from sun damage. We also registered a lot of increased poverty. So for people with albinism, because of our lack of melanin in our skin, we are very high prone to skin cancer. And what climate change has done is to ensure that what it means is we are working solo, long hours in the sun. And that's a huge challenge for us. We're exposing longer in the sun. And if we look at our data in Malawi, in all the 20 districts that we have been working, it has also seen that there is an increase in the cases of skin cancer across all these districts. And that, I think, an important element that we would want to highlight in terms of the direct link of this climate change and how it's affecting majority of persons with albinism. In this Green Grant project, we are also looking at how climate change has affected issues of recreation when you're working at looking at people with albinism. So majority of children cannot play in the sun, interacting with their kids. So what we are focusing on, how do we ensure that we plant trees around the households of people with albinism or families that have children with albinism, so that over a long time, we create a space where they can recreate with their friends, but also they can enjoy life like another child in the community. So it's one big component that we hope over a long period of time. We are not just addressing planting of trees, but also we are providing a safe space for children with albinism to play and interact with their fellow kids, which we strongly believe it will also help to deal with issues of stigma and discrimination and the social exclusion that is there in our community. Finally, I would want to say the work has also helped us to understand issues of the differences between male and female people with albinism. In most of the camps that we visited during these disasters, we noted that the majority of the male people with albinism, they were able to slip back into their community during these disasters. But the majority of the female people with albinism and women that are children with albinism, they were forced to stay in these camps. And what that means was the majority of them were complaining that they don't feel safe because of the killings and the attacks. They felt not safe to be in the camp, and that's why they were forced to go back at night secretly to sleep close to their relatives. And I think these are the serious challenges that most of our humanitarian programs have never addressed when they're responding to issues of climate change and disaster risk management. And we feel it's important to look at that. Finally, let me say that overall, the work that we're doing, if we look at the issues of skin cancer, issues of attacks and threats that are there at different levels when we look at climate change and people with albinism, important is to mention that all these things have really created or reproduced the inequalities that are already there when you look at persons with albinism. And this is why we're calling on urgent action to start now looking at how do we integrate and mainstream specific issues of persons with albinism into the climate change responses and also programs that will help us to be included, but also help to include all people with disabilities. Thank you.
Thank you very much, Bon. We really appreciate that. Tremendous as always. Now, to build on that, and something that may have been hinted at the beginning when we watched the wonderful video with Leila, the young woman, is again, we go back to IK Earl, who is the executive director of the African Albinism Network. And IK has some very important stuff for us to talk about. IK?
Thank you, James, and thank you to Boniface as well. So as we have scheduled now is an announcement and a call to action to each and every one of you. This is the moment to talk about the petition that we have launched in support of the UN expert on albinism's work. She is working on asking the WHO, the World Health Organization, to put back sunscreen as a concept back onto the list of essential medicines. This is critical for people with albinism, as has been outlined. I would give the example of Kenya, where since 2006, the government has spent about $1 million per year on people with albinism, a lot of that money going to the procurement of acceptable sunscreen, and skin cancer reportedly has declined over the years in that country. And so that's our case study to know that something as simple as reinstating sunscreen as a concept back to the WHO's list is life-saving for people with albinism. I want to take the opportunity to also say that climate change has other effects on people with albinism, in the sense that when climate change effects exacerbates poverty or causes economic shocks, as Moluka alluded, people with albinism can get blamed and in some cases get attacked. Madagascar is a key example of that, where a recent United Nations report has shown that people with albinism have been attacked in the country because of the cyclones that have ravaged several communities, causing economic shocks and increased rates of poverty. But since we are focusing on the issue of the petition in this webinar, I will speak about the petition calling on the WHO to reinstate sunscreen to the list of essential medicines, and that each of you can help us by signing the petition and spreading the word. When you sign the petition, it will show, it will send you a social media card that you can post and have other people on your networks, in your networks, sign the petition as well. If Debbie don't mind, could you share the slides? I'll just go through some key reasons why this petition is crucial. Thank you. Next slide, please. So here are some reasons why you're signing the petition and spreading it around is important. Skin cancer, as you have heard, is the #1 killer of people with albinism beyond the ritual attacks, which already has hundreds of cases So you can imagine how many lives have been lost to skin cancer. I personally have on my phone and computer many photos, scores of photos of young people who, many of whom didn't make it. There's one data set that illustrates that 90% of persons with albinism contract or die from skin cancer by their 40th birthday. UV rays is rising, as we heard from the expert, and skin cancer rates are also correspondingly rising. Persons with albinism are especially vulnerable, but we all know that we all are vulnerable to skin cancer. Sunscreen in general is unavailable, unaffordable for people with albinism. It is not a cosmetic, as you know, but a life-saving drug. Yet most times they cost about $10, $15 or $20, even in these countries where that's the exact amount people bring in as a monthly income. Therefore, this petition is definitely an issue of life and death, and you can make a difference just by spending 30 seconds signing it. The link to the petition is available on our website at africaalbinismnetwork.org. It will also be shared after this webinar in an email to follow up. Just to be clear, we have put the petition out in the last 2 months since International Albinism Awareness Day on June 13th, and we have been able to gather close to 3,000 signatures, but now we're hoping to take it worldwide with your help. I'll now call on Kwame to go through some of our targets so that you understand where we're coming from, where we're going, and with your help, how we can go further. Thank you very much.
Great. Thanks, Ike, and everyone for this great conversation. And it's a day that all of us need to take just a bit of action to ensure that this petition is going viral and reaching the targets that we are looking for. So as we speak, as Ike mentioned, our petition currently is, we are gathering signatures, and then we are still calling on every one of you to ensure that you add to this call. And currently we have 28%. Our target is 10,000 signatures by the end of this year, and we are just about 28% into that target, which sum up to a total of 2,879 signatures. That means we need almost about 7,000 more signatures to be able to reach our targets, and we can do this with your support. And yes, as of now, our petition has reached about 79 countries worldwide, including Ghana, Malawi, Germany, United Kingdom, USA, Zambia, and any other country. Probably if your country is not listed, that is an opportunity for you to ensure that you sign this petition so that your country can reflect on the list of countries. You need to increase that number to the 10,000 by the end of this year. And how do we go about that? It's very easy. I'm sure all of us listening to this call probably will see this webinar on various internet platforms such as Facebook, Instagram, LinkedIn, and all of that we are in. So the easiest way we can push this call is to share the petition with our network. Who are your network? All those your followers, your friends on Facebook and all social media. Just take a picture. You can see from the screen if it's being shared, there's a QR code. Those of you who are watching from or who are listening to us from your computers, you can just take your smartphone and scan that QR code, and you'll be able to sign that petition within 30 minutes. After signing, you can share with your WhatsApp, share that on your WhatsApp, share that on your Facebook, take a screenshot of this and then share on all social media handles that you can do as much as possible. And for those of us going to the Conference of Parties on the UNFCCC, which is happening from the 11th to the 22nd of November 2024 in Baku, Azerbaijan, yeah, this is an opportunity for us to also share this petition. Yes, you can reach out to AAN at info@africanalbinismnetwork.org, and we will share all the details with you that you can take along to Baku and then share with people to make sure that they also sign this petition to get the targets that we are looking for. Even if you get even double the target that we have, it will be great an opportunity for all of us to have this sunscreen reinstated on the NHS of each country, or the national medicine list of each country, as well as the World Health Organization's listing it on its EML, that is Essential Medicines List. And other things that we can do to ensure this call is moving forward is to mobilize resources to ensure that human rights issues that are associated with climate change and also loss and damage are also curtailed. You know, when you talk about loss and damage, how does that relate to persons with albinism? Skin cancer causes a lot of loss and damage. As I mentioned earlier, sources has it that 90% of persons with albinism either die or contract this disease before age 30. And it kills more persons with albinism than all the attacks combined over the 2 decades of attacks against persons with albinism. You know, so skin cancer is very deadly. So let's all mobilize resources to ensure that we put this disease to its barest minimum. The other thing we can do is probably partnering with the World Health Organization to be able to advocate internally through, if you have people who are in this webinar and they work with the World Health Organization, it's an opportunity for you to push the word through your boss to get to the top and then to get to whoever is taking the decision on the essential medicines list to ensure that this is listed. So partnership with the World Health Organization to ensure this is done, it's great, and we are looking for such opportunities. In case you have any of such, please let us know, and then we'll be able to collaborate and work with the World Health Organization. And also in the application for these essential medicines to be listed on the essential medicines list. The other thing that we are asking you to do is to also take the advocacy. We should not only leave it at the international level, but let's take it to our national governments, our local levels. You can be your district governor or whoever is making decisions in your local community. It's a call on to all of us to start the advocacy at that level. It can be through the Ministry of Health, it can be through any other ministry that is in charge of health, to ensure that they are listening to you. It can be a simple letter asking them. It can be a simple call to action. You can talk to, or you can partner with radio stations. You can partner with TV stations to make this call to your government to ensure that they are adding sunscreens to the essential medicines list so that you can have it at no cost or at a minimal cost in your country. And the other one we can do is through the Ministry of Foreign Affairs. The Ministry of Foreign Affairs they are always in touch with international organizations that can push this call. So we can also probably do something, write a simple letter, have a simple call with them, or have a conversation around how we can all include this essential drug, not to say drug, but medicine on the essential medicines list for persons with albinism. And also, one thing about sunscreen is it's not only for persons with albinism. Everyone needs it. So what if it's added, the benefit is not only going to persons with albinism, but all of us are going to be benefiting from it. So it is onto us to push this so that we can all benefit at the end. And then the last thing I would like to do, last but not the least, is to help us to ensure that those countries or those organizations that are producing sunscreen locally, we support them, we provide them the needed support. If it's a government that is going to help them to expand their production, let government help to do that. And if you also seek any other support for local sunscreen production, we have to make the opportunity work so that this can be done. For example, we have Beyond Sun Care that is doing a great job by producing sunscreen locally. When you go to Tanzania, you have the Regional Dermatology Center, Dermatology Training Center, that is producing sunscreen in Tanzania and other countries. That that are having this, especially we talk about PFAB Foundation, also supporting some Francophone countries to produce sunscreen locally. We need to support this initiative to ensure that sunscreen is readily available at a very low cost or even distributed to persons with albinism for free. This, I call on you to scan and then ensure that this petition gets to every one of us, our friends, our church members, our community members, so that they can sign as much as possible. I thank you.
Thank you, Kaime, and thank you, AK, too. Everybody, that was wonderful, and we can see why we're all here today. This is the start of something. This is not the end of it. It's the beginning of a journey we're going together. And don't worry, we're going to send out an email to everybody that's attended today and those people that haven't, that may have had something else, with all this information about how you can get involved in the campaign, how you can sign this petition. We talk about activism and agency, and I remember, I'm going to use it just for a second. I remember many years ago, I'm a disabled person and part of a disability rights movement. An older activist said to me that activism can be anything. It can be drawing a picture, it could be signing a petition, it can be protesting. This is a form of democratic activism to show solidarity with our fellow citizens and our fellow brothers and sisters. So building on that wonderful, wonderful launch by IK and by Kaime, I'd like to just have a few reflections and ask this superb panel of people that we have here today, Ms. Ivy Kilhar from CBM Global, Meana Molman from the Fund for Global Human Rights, and Mr. Mohammed Alamin Sadikan from Can International. So Ivy, I will go to you first and ask you, why do you support this process and why do you think this is such a vital importance?
Good morning, good evening, good afternoon, everyone. Thank you for joining us on this wonderful day, and thanks, James, for those questions. So I would like for people to imagine something, that you as a person do the least but are the most affected. That's what happens to people like me. We're not engaged or involved in ensuring that we have climate change, but we are the ones who are suffering the most. So it's very important for us to realize that if we want things to change, we all have to get involved. And that for me would be my first call. You all have to get involved. Because when we look at the broader picture of persons with disabilities and where we are on the table when it comes to climate change, we're not. If we look at the Paris Agreement, we're actually not written into a lot of the, measures that people are going to take and countries and states are going to take in terms of looking at how they address climate change. When it comes to persons with albinism, the reason why it's important for us to be considered using the Sunscreen methodology of distribution of sunscreen is because once we're on that essential medicines list, it means that sunscreen comes to the very local level where sunscreen is given for free. So for example, I can mention Kenya. Brilliant example, but sunscreen, unfortunately, is not on the essential drugs list of Kenya. So that means when it is being distributed, it gets to the district level. So it doesn't go to the bottom level where someone will be able to walk to go and get it. So in case you didn't know, persons with albinism are not rich. They have different challenges. That means sometimes when they're younger, their caregivers are not able to work depending on where the countries are, or they have to support them in one way or the other. So they come from low income housing households, so they are unable to have extra money. So if the sunscreen is only at the district level and not at the local level, a parent then has to decide, do we eat or do we, enter a bus and then go and get the sunscreen? And remember, because the sunscreen does get finished, this will be a recurrent expenditure in the household. So once we make it part of the essential drugs list, it means that it will get to the person who can least afford it, but is most affected. Because as the previous speakers have mentioned, and also the video mentioned, if someone is helping their parents in the field, for example, if it's children or an adult who has albinism, then they are getting the rays of the sun at the hottest time because they have to work. That's how they're going to survive. So putting it on the essential medicines list means that for people who didn't know about albinism, then they know. So they start getting involved in the activism. They start doing more research. They start getting more data in, and then we have more partnerships that come in. I think it's globally known that oncologists are not enough for all of us when you look at the ratio of patients to doctors. So we want more people to get involved, to help us do the research, to help us collect the data, so that we're able to do more. In a sense, that will mean that the people who have disabilities, people who have albinism, then are able to live a life that is dignified, and they're able to reach their full potential. So I believe that, putting sunscreen on the essential medicines list means that we're going to have health equity. And that's really important in this day and age. So I'm hoping that all of you are going to be involved in the petition, and not just the petition now, just going forward, wherever you are, in whichever spaces you are, ask this question when it comes to climate change. Where are persons with disability? Why are they not there speaking for themselves? Why are they not being the ones to get the funding? Why is it that no one's doing enough research to see how to help them to have a fuller life? So I'm not going to belabor the point. I think we have quite a number of supporters, and I'm really, really grateful for all of you who have joined us. I'm trying to read the number of how many people are on this call. So I'll hand it back over to James. Thank you.
Thank you, Ivy. Ivy, I'm not great with mathematics, but I think there's about 2 million people involved in the call today. No, I'm only joking. There's about 100. Thank you so much, Ivy. That was tremendous. Marianne, could I ask you the same question too? Why are you supporting this, and what are your views on the process? Thank you.
Sure. Thank you very much. So my name is Mayana, and for the purposes of inclusion, I'm a middle-aged white woman with short gray hair. I'm wearing glasses with a dark frame and a black sleeveless shirt. I'm also wearing a pretty chunky gray headset because it's hard to hear sometimes. And behind me is a photo from a country road in the Philippines and the logo of the Fund for Global Human Rights where I work. I will be speaking about what allyship looks like in the context of climate and people with albinism and why it matters. The Fund for Global Human Rights is an intersectional funder investing in the power of human rights activism broadly understood. So this means that we support an ecosystem of various actors taking on the systems, the structures that create exclusion, whatever they look like, wherever they are. So ally work from the Fund of Global Human Rights perspective isn't just about supporting one group or even a group of groups. It's also not about declaring that one issue is more important than another issue or that one type of suffering matters more than another. At its very heart, allyship is about holding ambiguity and nuance in our analysis while acting specifically and concretely. And I'll try to explain that in my short 2-3 minutes. Allyship of any kind means to understand that the unique challenges somebody else faces, they may not be my specific challenges, but our ambitions are ultimately the same: to live full lives, to exercise our full humanity, in short, to be fully ourselves. So to be a good ally, when I don't understand something, I ask, and when I get something wrong, I apologize and I commit to try to do better. In this specific case, allyship is trusting that when someone with albinism says to me, access to sunscreen as an essential medicine is my challenge, increased skin cancer, increased violence as a result of climate change is my challenge, well, then I believe that this challenge is real, and most importantly, I believe it matters. That's what allyship is. Why it matters becomes particularly clear in the case of disability and the disability rights movement. The movement for disability rights has always embodied both very specific struggles, accessibility and health needs, for example, like we see here, as well as broader struggles for justice, bodily autonomy, autonomy of movement and thought, recognition of agency, combating assumed helplessness, or even assumptions around what quality of life or dignity is. These issues affect all of us. In fact, when we advocate alongside people with albinism, we're not just addressing one issue. We're tackling the web of oppression that starts in ableism, but also includes racism, sexism, classism, and so on. Exclusion and discrimination takes all of these expressions. And so when we support the concrete asks raised by persons with albinism, we're also confronting deeper and broader societal issues. The fact is that all of us are affected when anyone's rights are curtailed. And you've probably heard that before. Usually the sentiment is expressed like a caution. First, they come from one group, and if I don't stand up by the time they come for me, there's no one left to stand up for me. That is probably true, but that's not what I mean right now. What I mean is that when we create societies where some human beings are valued more than others, everyone's humanity is compromised. It's just not possible to justify and ignore discrimination and exclusion without losing some part of ourselves, some part of our soul, if you will. Or put differently, our liberation is interconnected. When we create a society that embraces people with albinism, we're creating a society that values all individuals. That's why the Fund for Global Human Rights supports the power of disability rights activism, the power of activism for people with albinism as a core part of our work to strengthen the global movement for human rights. Thank you.
Man, that was tremendous. Thank you so much. And it reminds me of the slogan, not within the disability human rights movement, of nothing about us without us. And I think we've moved towards nothing without us. And if all are not free, none are free. So thank you so much for that. That was wonderful. And finally, ladies and gentlemen, and everybody else that's tuned in, we have Mr. Mr. Mohammed Lain Sadiq Khan from Khan International. We're very delighted to have you here, Mohammed, who's going to give us his perspective on the petition and on the project itself.
Great. Thank you so much, James, for having me, and greetings from Senegal to all of you who are in this webinar. I am Mohamed Lamine, as James said. I'm head of building power at Climate Action Network International. So lead on the campaigning, advocacy work and movement building work that includes allyship. So it's right to be here. I'm very happy and honored to be here. And also being an African, promoting the rights of all Africans have been my life. I've led the largest Pan-African movement for so many years called Africans Rising. So pushing for rights, including the rights of albinos, albinism. So it's very critical for us to talk about the rights. Khan International is the largest climate network in the world with 2,000 members in 150 countries across the world, and we support and promote climate justice issues. One that is critical to start with is that we have seen, and it's evident, that there is an increased climate crisis that we are faced with day in, day out. Citizens are a challenge, including people living with albinism people. Why I'm making more emphasis around why it's critical for the whole globe to be in solidarity with this project, with albinism, people living with albinism, is that the climate crisis is caused by, critically, science told us, caused by the burning of fossil fuels. The major 80% of the cause of the climate crisis is around burning fossil fuels. And the trend of this happening is very high. That's why we all have to unify ourselves to push for redress, to push for actions to be in place that will prevent and protect people of albinism. Because there'll be increased heat. As I speak to you right now, it's very hot in Senegal. People are struggling to bear the heat, especially people of albinism. So that is why it is critical for us to promote and support this petition because essential medications and essential services need to be free. And that is why CAN International have pushed for the loss and damage fund to be in place. We have been, advocating for many years for the loss and damage fund to be in place in the UNFCCC. That is our business. That is our bread and butter. Pushing in the policy spaces, but also in the movement-wide spaces, governments to really do the right thing. But the loss and damage fund is in place. It's going to be in place by next year. It's going to be operationalized. But it needs to address, that fund needs to be available for communities like people in albinism or people of albinism, so that they can have direct access to this fund. The governments also have to have mechanisms that are in place that will be able to access this fund. The fund is going to be hosted under the World Bank, but we are pushing for the fund to be having more flexible mechanism, more flexible conditions that will allow communities to access this fund. And one of those is the people of albinism. So having most part of the fund to be channeled to redressing the impact of climate on lives and communities. I want to say, unfortunately, the advocacy around having this fund in place have not included much more as it should the people living with disabilities, especially the people of albinism. CAN International have been creating space and supporting in a wider movement work people of albinism, people of disability in our processes and pushing for their rights to be included in all the different processes. We have a health working group in CAN that promotes and advances health rights. And a call for a petition to be signed is a critical thing, and it's time. Why I'm saying it is time, because this year is the finance year, as we call it in the UNFCCC spaces. We are asking and demanding for the UNFCCC richer nations to put on the table the new finance collective goal, which is called NCQG, to be 5 trillion to be budgeted, so that communities of poorer countries can have access to climate finance, to be able to support communities to adapt, like people in asking for a mere and basic need of a sunscreen medication to be for free. But if the climate finance is not put on the table by richer nations that are causing the brunt of the climate crisis, then we can't address these kind of things. So that's why this petition is critical. And within our networks, we will share this petition. We will encourage our members to endorse this petition. We will, work with, the African Albinism Network to really advance this. And I'll encourage them to join the Climate Action Network Africa team, so that they will be mainstream and they can have their climate agendas or their agendas, put forward in different climate spaces across. Let me also quickly state that it is critical for us to work in solidarity with each other, because one right affects, it means the whole world is affected. When you kill one person, when you allow one person to die because of injustices, of lack of risk. Please start. Sorry about that. Distracted by my son.
You're okay, Mohammed. You're okay.
Sorry
no worries.
about that. My son.
That's no problem.
With a cry. When you're working from home, that can be some challenging. But let me say, I was gonna say, in Africa, we believe in what we call Ubuntu. I am you, you are me. If I'm affected, then you're affected. So that's why the rights of albinism is critical. When one right is affected, the rest of us should really be in solidarity and support. So part of this solidarity work, CAN International have been building, a whole movement-wide solidarity efforts. Every year we do annual mobilization, and these mobilizations, bring communities and movements together to raise their demands and their issues on. This September, we mobilized in about 56 countries, pushing for climate finance, for finance to be in place, but also pushing for the operationalization of the loss and damage fund that will address the needs of communities. So that's why I said this petition comes in the right time. Let me also say that we have been pushing for end fossil fuels and the phase out of fossil fuels, because fossil fuels have been the major responsible of the climate crisis. And if you don't address it, then we will be faced with the consequences of the climate catastrophe. And in that case, last year, we got an end fossil fuels language in the UNFCCC processes, but this is not enough, because what we need is, it needs to be financed. The fossil fuel phase out need to be financed, but it also have to be equitable. That means the global north countries that are more responsible of the climate crisis need to take the first step of phasing out fossil fuels. So the advocacy continues. The advocacy and the advancement of this continues for us to advance. So we need to have the albinism community in front of the advocacy of the advocacy around climate crisis or climate change, because they are facing the brunt of the impact of climate crisis. When you talk about flood, the community is more affected. When you talk about drought, the community is more affected. When you talk about diseases that it comes with, the climate crisis comes with, they are more affected. So we need to create space. We need to create, opportunities for them to speak for themselves, and then create the space to be in solidarity with them, to push for redress. It is a right-based issue. It is a right-based issue. That is why the people who are responsible of the climate crisis must be held accountable. And these are the richer nations that must pay the brunt.
Thank you.
Finally,
thanks very much. Sorry, we're just very tight for time, so we might go quickly on them, if that's okay.
Yeah, that's fine. That's fine. I want to say that the petition will be shared across our networks. Thank you.
Thank you. And I think that's wonderful. And I know yourself, when we're working from home, things happen. I've had cats jump on me and everything. That was wonderful. Thank you so much, Mohammed. And I think this is important to state that it is about allyship, and it is about saying that we have to be part of the climate dialogue. Disabled people are not just an add-on, or people with albinism are not just an add-on or an energy burden. We're central to this. We're all citizens of this world, and that everyone needs to take part in this dialogue. Before we open up for questions and answers, and we may have time for some, I'm just going to summarize really quickly, and then we'll stop the recording. I wanted to thank everyone today. I want to thank our illustrious bunch of speakers. I want to thank Ivy. Thank you so much. I want to thank Mayana. I want to thank Mohammed. I want to thank, of course, the wonderful guys in Standing Voice, Mr. Boniface Massa. I want to thank IK, and I want to thank Kaime and the many more other people who are taking part of this again and again and again. And of course, I want to thank CBM Global, Debbie behind the scenes, who's doing a wonderful job. I want to thank everyone else that's taken part, and I want to thank my colleagues in CBM Ireland. And I want to thank you for coming. I will end on this before we open it to questions. There's a lot of bad things in this world. There are things that happen we have no control of. There is injustices, we know that. But there is also good things, and this is a good thing. This is something we can all be active in. This is all something that we can show our self-determination and do. And it's not about doing it because we can, it's doing it because we have to. We need to show that we mean what we say, and we say what we mean. We can sign this petition. Like Kaima said so eloquently, we put it to our politicians, send it to our friends, share it on Facebook, share it on Instagram. Let's do it. We can do this together. I know we can. Because if we don't, and if we don't look after each other, then nobody will, but we can do this. And I think that's what we're here for to do. So thank you so much, everybody. I really appreciate you coming. You will get the email with the link to the petition. We will keep you updated if there's anything else. Please keep an eye on our socials and African Albinism Network socials as well. I'm going to stop recording there, Debbie, if that's okay, and then we can open it to maybe 5 to 10 minutes of questions.